I got the Bucks defense. I'm looking for the Bucks defense to put up a solid 15 this week.
Who I have. Oh, I have San Francisco.
That's a good defense. My defense didn't. I got -3 out of them against New Orleans, but that's because Jameis went in. But that just turns out because the Saints have got a really good offense. Like they got a powerful offense.
Good, Tony?
Oh yeah, let me put this up.
But
It says your name.
it's gonna be an ugly game this week.
Huh? Saturday or Sunday?
I got a good defense. I got Bucks defense this weekend, and I got the Falcons' best player on my roster. Young Way Cool. That's it. Hey, tell me he'll probably score the most out of any fantasy. He'll be the highest fantasy player on the Falcons this year. The kickers. Huh?
No way.
How? Who's going to score more fantasy points on that team? Yeah, all 4 passes he got last week. That's what's happened. Matt Ryan, yeah. I'd hate to be a receiver on a team where Matt Ryan's throwing a fuck 20 a game.
Matt Ryan gave me almost
It
7
doesn't
points last
matter.
week.
You have like 2 seconds. The receivers are getting like 2 yards down the field before he's on his ass.
That's the point. That's what I'm saying. And
Hey, man,
Young
don't
Way-
make fun of this Falcons.
And young Way Cool gonna be wearing that thing out for 50 out for the rest of the year, son.
He's such a sly pig. He's a lot of man.
Yeah.
I think I'm better kicker.
They're trying to get you right now.
Him and Rodrigo.
That picture of him and you.
How many points did he give you last week?
Who? Young Way, 6. All 2 field goals that we got him to kick.
The 11 Sam.
I mean, we never even got close enough to get him.
My kicker at 16.
Wow.
Tyler Bass,
I
another
was
Georgia
confused
Southern
as to like
product.
how points are
Georgia Southern,
calculated
baby.
kickers.
You see that our first guy, or the guy this year, first field goal, the freshman was like a 49-yard field goal. That's great.
Is that what comes out of GS kickers?
Georgia Southern price.
Solid kickers.
Matt Breida. He's good.
Rita's from Georgia?
Breida and the
Oh, yeah. Wow, I didn't know
We're
that.
going out there.
Have you
Oh, no,
seen
they
this
got a couple of
competition?
Someone on Sunday night called with the Rams. They're like Georgia Southern.
Yeah.
I don't remember who.
It's like
crazy. They introduced us as like Georgia Southern.
They've got, well, J.J. Wilcox playing in Dallas for a while. I don't know where he's at. And the Bears,
I didn't know
Bears
you
have
call it like the
not Iron.
or the crank it.
I know Bears have like some linebackers.
Georgia Southern putting out a couple players, huh? Yeah, obviously.
Pull them pistols and look at
Kicking school.
KU, kicking university.
Oh, good one.
So, we ready?
We're ready.
All right, so, evaluation team's good. All right, guys, who's running the show
Everybody
today?
but one.
Parker's running the show. All right, so, you guys can start when you're ready. All right, we're gonna get started back in the back. We're fixing to start.
All right, so we have a 50-year-old male. Your general impression if you arrive to a residential house for a meal.
Hey, we got started up here, guys.
You arrive to a residential house for a meal, sitting up against the couch on the living room floor. His wife answers the door aggressively, yelling at her husband. As you approach the patient, you see several beer bottles scattered throughout the room.
I told him to stop drinking. He drinks way too much.
So the wife is being aggressive. Can he speak? Is he conscious?
He's conscious.
Okay, so
Say no time.
all right, things that sounds serious. Hello, sir. I'm gonna be treating you today. My name is Jaden. I'm with the cab. And how's the airway looking?
The airway's clear.
Airway's clear. Breathing. I don't think is it even on? I don't think it's on.
We got no live action over here, boss.
It's moving.
There it goes.
Yeah, it's moving. It's just, okay, so there. All right, how's the circulation? The skin.
Warm, dry.
Okay. How many drinks do you have today, sir? Can we get some
That's way
vitals
too
going?
many.
Too many? Can we get some vitals going, try to get blood pressure? Also,
Yeah.
Yes, can we get a transport unit as well?
Or you sit around.
Still gonna call it in.
I'm gonna call it a
You're a fire truck, so dispatch you and an ambulance.
Okay.
Williams, turn that around.
Oh, strong and weak.
Push, analyze, connect electrodes.
Gonna get an actual blood pressure? So he's gonna tell us what to ask.
Since you've got the cup on, you can ask.
Okay, what's his blood pressure?
248 over 168.
His pulse, how's his pulse going? We got a pulse ox on?
Pulse ox,
Yeah.
93.
Is it 93?
Yes, sir.
Yes. We're gonna put a nasal cannula on it. And it's gonna be 6 liters. 6 liters. Okay, we just got a glucose up. Can I get a glucose real quick? 40. 40. By what time did he start feeling, like was he sitting out and she knows he was good?
About 20 minutes ago.
About 20 minutes ago. Okay. Do I notice anything wrong with him, like when I'm looking at his face or anything like that?
In his face, yeah, you notice some droop on the left side.
Drooping on the left side. Okay. He can't lift his arms up or anything, can he? Can't really speak. You got
One arm.
his right arm? No, right arm. You got a facial droop, you can lift his right arm up. Let's see. We can put him on some oxygen. What's his past medical history? Does he have a history of strokes?
Yeah, he has a history.
He does. And high blood pressure. Do I notice any other signs and symptoms?
Yeah.
Edema anywhere, looking at his head or anything like that? Check his head.
Nothing else on his head.
Nothing on his head. How about his neck? JVD, anything? How about his chest? His chest. Maybe on his chest, abdomen. Okay. How about his legs?
Hey, Jaden, what's this clear?
He had a history of stroke and hypertension. So what about the legs? Clear. Clear the legs. Feet. How about his back? Arms good and everything. Lift that one arm up. Okay. You can't find some of the stuff?
Huh?
You can't find some.
We ain't got no regulator on the tank, so
We can call that in.
they're on the way already. He's at 93.
They just said we're calling it in because we don't have a regulator on ours.
So what are you gonna do?
They just called it in already.
Call it into what?
Medical control.
Yeah,
To get
what-
it. What's it called? ALS, BLS to bring us in.
You're right. Call dispatch. So start you
Just
another
call
unit.
dispatch. Is he allergic to anything? Is he taking any medications? No, he's not. Nothing. How about his last order? Take it easy.
We went to Waffle House last night, got double bacon Texas patty.
Okay, cool.
Here.
And the events that led
Hey,
to this,
Here, O2 regulator.
events that led to this, just drinking, sitting up,
Just drinking beer.
drinking beer, okay. So. Sitting there. Outside. On the porch. He was on the porch, right? Sitting down on the porch. Oh, he was on the couch.
He's on the floor leaning against the couch.
On the floor. Then. Did he fall? He didn't fall. He was just drunk and slid off the couch or something. Okay.
See where to do anything?
No, he's not. And no, he's not taking any medications. His last order intake, he ate Waffle House. In events, he said he was drinking beer. How far is our transport unit? We just put an air can on 2 liters a minute. You can start out. Yeah, that's why I'm asking. Yellow card. We got a yellow card.
Lou wanted me to tell you that you should have been a store clerk.
Stroke alert. Could you please call that in? JJ just said it. We're taking them in the Lambo.
No, you've done it. We just need transport.
Yeah.
Oh, yeah, no, we want to get you, just get an IV started per se. Just get.
Could you
access.
let them know that we're gonna try to start IV? We're not gonna get there.
Oh, so we just simulated that we started. We got them for it.
We can just say we simulated an IV. We're not gonna give you any medication.
That's fine. Yeah, stipulate it.
IV access. Okay. Yep. Been like 5 minutes out here. Let's slow it. I'm gonna check. I already did. So I'll check it back. How's it breathing after I'm gonna say my name is Canada?
His breathing is still at 12 minutes average. Yeah, we're requesting.
Okay.
93.
SpO2 is still at 93.
Okay. We can get another set of blood. Just can we get another blood pressure? It's the same. Big start 90. You just started IV access. Yeah.
260 over 170.
260 over 170. How about this post? We got a post ox on.
Pulse ox is still at 93.
Respiratory rate.
Let's go.
Yellow card.
His heart's gonna explode. That blood pressure's skyrocketing.
So what do we do?
170.
For
Then tell, if you don't know something, then tell them to walk you through the Cincinnati scoring.
Could you ask them what we could do for the blood pressure? Since it's so high. Please.
35 minutes of transport.
Oh, that's gonna fast.
It's just 5 minutes away.
What's it like? Can we get an air transport?
Could you ask them about blood pressure, please?
10 minutes out. Cincinnati.
Is his head still good? His neck still good? Checking around his nose.
Bleeding
Bleeding or
still
anything.
has that droop.
Still has the droop. Any edema anywhere else? Okay, with his chest okay. His arms, he can still lift that one arm up. The other arm was okay. Okay, how about his abdomen? Check his abdomen so again. All right, his legs, still okay, feet, still okay, PMS, see everything PMS.
What's his middle status?
Check the A no times 4. Oh, how is his mental status now? A no times 1 now. A no times 1 now. How's his back? That's fine. Get back to you.
Wait, no. Keep the head elevated.
He's
Right, sitting up. Could we just make a snake sitting up, or do we have to sit him up?
You don't have to. I mean, y'all, that's
We got his head elevated. I'm
Yeah,
good.
he's been sitting up.
Alright, go ahead.
Scenario.
Go ahead and do Cincinnati. So special group, pull his arms up. And
He can't. I already did that. He has the facial droop on his. You said the facial droop on left side, and he can't. He lifts his right arm up. He can't speak. No. No, my bad. Is that's not what you said? I thought you said you
So
can't. You
do
can lift his
the
right arm.
test.
Do that.
Do-
Do
just
Alright,
do-
so
let me
he's had
see you
facial
do it.
He has facial droop on his right side. I see it. I mean, his left side.
Okay,
He can't lift his arms up. I actually lift his
then
arms
try.
up.
All right, so sir, can you do me a favor? I want to check your arms for a second. So what I want you to do is I want you to stick your arm straight in front of you. So can he move either arm?
You can move,
Right arm.
He can move the right arm, but he can't move the left arm, correct? Okay, so, all right, sir, I want you to close your eyes and I want you to keep your arms in the air. And so then we depend on them. Okay, so you've done your facial droop. You've noticed that, right? You did this, right? So what other part of the speech? So what do you want him to say?
So, you teach a dog.
Can't teach an old dog.
You can't teach an old dog new tricks. Could you say that, sir? Can't say a time. What time did it start? Said about 20 minutes. When was he last known?
20 minutes before y'all showed up.
20 minutes.
All right, so give them an exact time. Make it up. I don't care.
We already had 20 minutes on there.
So at 9:15, 09:15 was his last normal.
09:15 was his last normal.
Where's the helicopter?
Is his blood pressure still raising? We still got it on. It's still going up. It's at the last report. It's at the last report. Okay. Is everything set at the last report? It's the SBO2 is the 89. It's not 89. Let's switch to a normal breathing.
Here, sir.
It's on your face. It's a little more oxygen.
Get the LG set up too.
What?
Show like point somewhere like this is our LZ.
So what?
Over there, like, this is our LZ for something.
This is our LZ for the helicopter. This is our LZ for the helicopter.
Okay.
Established.
Do you have enough resources to land a helicopter and take care of your patient?
So
Which one of these guys are gonna set up your LZ?
Arco 7 LZ.
Okay, so that's probably all you need really.
Okay.
It's just cut one loose to set up an LZ. Or you could call for an additional unit, whichever one you want.
We already did.
Yeah, but they went back available after they bought two. But if you- That's
I
okay.
mean, I don't think you
I just wanted to see, and I'm just letting you know that you don't have to. But I just wanted to let you know
What you couldn't do.
that's what you can do.
I don't think we need any additional help. Well, he's on LZ. So we can keep taking care of him, but there's not much we can do.
This is both now. Yeah, you don't need to go on.
Let's just post now.
It's supposed to be at 80.
Everything is the same. Blood pressure still on, pressure rate, everything. He's been fine. Where the heck?
All right, bring them back in. Y'all need to stop worrying about like when the helicopters come in, when the ambulance is coming, and get comfortable. Get comfortable and treat your patient. I know y'all want to get the for the patient best interest to get them out of there, but it's the way it works, nowadays. We have a major issue with being that and having available resources to take people to the hospital. All right, so tell us about what they were presented with.
So you guys were presented with this stroke patient, had signs of like alcoholism. So she was a painful picture, person being an alcoholic, and got a stroke patient. So we just kind of wanted to go out and the test for Cincinnati and just do a standard primary survey and like right now.
All right. Talk to me, Williams.
I think we did good. I don't think we messed up on anything really. The only thing we messed up on was, Bloom pointed out, we needed to call in stroke alert faster. That was pretty much it. Like he said it, and then Bloom, they raised the yellow card when he said it too. So that's the only thing I think we messed up on. But everything else we pretty much covered. We got the time. We knew it was 20 minutes because I asked him stuff about the arms. I asked him about that in the beginning. Basically, everything I asked him about that in the beginning. So I think we pretty much covered everything.
Evaluation team.
I mean, like you said, I think you did a pretty good job. The stroke alert thing, I mean, that threw me off. I was like, because when Bloom came up and it said it originally, I was like, oh yeah, but then again, time and that is moving way faster than what it's actually moving up here. So, I mean, I know JJ had said it, and then literally like a second later, Bloom came up and said something about it. So, I mean, other than that, did pretty well. You mean, for the patient through all that. The Cincinnati test, went through it. I think you did good. I think the team worked out. The O2 thing kind of set y'all back for a second, but it's a minor thing for how y'all acted today. So overall, I think y'all did good.
I think you need to just focus on the symptoms still. Focus on just treating the symptoms, like even just the ones that you have written down, because you've given the nasal cannula 2 liters a minute, it was at 93%, and it just stayed at that the whole time.
Yeah, but I think you might have done right with that in a way, because this with STEMIs and with strokes. What are you trying to maintain your pulse ox to? What are you trying to maintain it up to? Are you trying to get 100%? What are you trying to get? That's right. You're trying to get 94 because of the free radical theory and the vasoconstriction, more increase in intracranial pressure from higher O2 sats.
His O2 dropped down to 89.
It did. I was going to ask about that though too, because I was, you probably did right supplemental O2 with a cannula. When it dropped to 89, I would have been concerned about, okay, are we missing something? Is this stroke leading to, are we going to failure type deal? I would want to investigate that side of it. Because that's probably where I would have wanted to go. If I was in your shoes, I'd want to go, okay, well, he's at 89. That's a lot different. where we headed. That's kind of where I was.
That was the only thing I had, because it dropped, so I was like, something's not going
Yeah,
right.
drop, and then we switched it to an hour breather.
Yeah, I mean, you didn't have a choice then to switch to an artery breather, because then you're like, well, I mean, and that's what you're supposed to do, right? I mean, if a patient's in distress, you're not withhold oxygen because of the free radical theory. Only if you have a patient who's breathing normally, we don't want to add to it. But once he hit 89, you didn't have a choice. You had to give an artery breather. When?
I think y'all are good. The only thing I noticed kind of is try to be like, I know it's a dummy, but try to be a little more personal. Like as far as like the stroke test and everything, but I get it. It's hard.
Mitchell? My question is this, blood sugar was what? Was it 40? How did you guys deal with the blood sugar?
We really didn't.
Okay, so this patient could have been just flat out diabetic, never have had a stroke. Because stroke symptoms present would just like hypoglycemic patients. They can have a facial tears, they can have paralysis, they can have all that. So you may have had just an expensive helicopter ride for a diabetic emergency to handle. And I had this at the hospital yesterday.
I didn't even think about that. Maybe one time, but it should be.
Right. And so did you go down your OPQRST?
I mean, we didn't really, no, I didn't.
Okay.
I didn't see it.
Right, because if you had to, you would have found out that it was supposed to be type 1 diabetic.
You didn't have to.
Type 1 diabetic, and so you would have found out that he takes insulin, and that would have cued you in, hey, what's the sugar again? Right. And what medicine is he taking?
Hypertension.
He asked for medical history and.
I'm sorry.
I asked about
Okay.
Yeah, I didn't do OPQRS, but I did samples. So I got
Okay, fine.
information.
Okay.
So all we gave him was a history of stroke and high blood pressure.
Okay. I don't know then, but I mean, when you have a sugar that low, you gotta treat it.
Right.
I had this at the hospital yesterday, or whatever, I was there last, we had a patient with severe abdominal pain, vomiting, middle-aged female patient and comes in, and let me ask y'all this, with that scenario, you're transporting to the hospital, right? You do a blood sugar glucose inside the ambulance on the way to the hospital. And this patient who's been vomiting times 2 days, who looks like hell, just malice, sick, you get a blood sugar of 46. All right. How would you guys treat a blood sugar of 46? She's conscious and there times 3. It's a decent blood pressure. Okay, she's vomiting. Why would you do that? Why would you go that route? Why wouldn't you just start an IV and give sugar? Okay, you said that. He didn't say that. Though. All right, so look, be clear, because I don't want y'all making that mistake. Glucagon is for when you can't get a line. If you can't get an IV, you have a diabetic patient, use your glucagon while people are still looking for a line, or while you're establishing an IO. Okay, one of the two. That's what glucagon is there for. Will it work? Probably not, because the body probably already tapped into those resources. We have glucagon. Body's going to make glucagon. It's going to tap into that to try to use that reserve sugar anyway. But you might get lucky and it might work. But my experience is about 10% of the time.
I have a question about the glucose meter. How often do they check on that?
They don't.
So
Very rarely.
how accurate do you think it would be?
Somehow it stays pretty accurate, believe it or not.
I was talking about that.
I mean, I know we both work at Sada Hospital and we calibrate them every day there. But some, I mean, I'm sure, I mean, they're pretty close. I don't know how, but every now and then you're gonna run into one that's not, you got to, but for the most part, they're pretty good. All right, so the other thing I have, and this is not for you, it's the class as a whole. And do not get into this habit that you've already got into, and that you probably picked up a little bit from the field. If I put the pulse ox on the patient and I get a pulse rate, is it a possibility that my actual radial pulse or whatever I check can be different than what's on the pulse ox? Absolutely, all day long. So you do not stop checking and confirming your pulse rate. It's okay to get a pulse rate with the pulse ox as long as you're feeling for it and making sure that, yeah, it feels like it's fast and the pulse ox says 120 beats per minute, or it feels kind of slow and the pulse ox says 48. Confirm it, because you could have a patient who has a pulse rate completely different than what the pulse ox is showing. So do that. We got the exact time, and that's extremely important in the stroke call. And let me see what else I put on here. And we called the stroke alert. And even though that some of the evaluation team said, you know, it went quick enough,
I thought it was pretty bad.
that's pretty, I thought so too. Honestly thought that was pretty good. You caught it while you were with the patient, right? And that's important. That's really important. And you caught it. You didn't go to the hospital with a stroke patient, not call it. My question to y'all is this, is though, what if the patient only had a facial droop, but did not had a normal arm drift test, and had a normal speech test, could repeat, you know, the sky's blue over Cincinnati. Huh? Okay, I'm sorry. No, yeah, Bell palsy, it could be, but my question is, if you just have that, do you call a stroke alert still, or do you not call a stroke alert?
Still call it. You call it.
Call it. You only need one of those.
That's why I said I know that.
It does, but you can't rule out that they're not having a stroke too. So go ahead and call a stroke alert. You know, all the stroke alert's gonna do is let us know that you're coming in, and we make the patient a priority to go down to CT for a quick little CT scan. We're not busting open trays. We're not calling in a neurologist. We're not doing anything other than, okay, as soon as they hit the door, we're on a time frame. We want to get this patient to CT within the first, 10 minutes of being there. Because if they don't have a bleed in their brain, we're going to start treating them with drugs to try to open up that clot. So call your stroke alert. Worst case scenario is they get a CT scan, and they're probably going to get that anyway.
I got a question for you. Even with the high blood pressure, so do you think on the blood sugar for you?
I would call med control. If you suspect an intracranial bleed, not a stroke, but an intracranial hemorrhage, then that might be something that they might tell you to hold off on. But for the most part, I doubt it, because we want to know if those symptoms are a result of the blood sugar. And so what we may not tell you to give the whole 25 grams, we may tell you to give half.
Was there anything I could do for the blood pressure?
Nothing you can do for the blood pressure. Yes, sir. It's open, but they're vomiting. And so if I've got somebody who's already vomiting, I don't want to give anything by mouth. Because what's going to... Yep, right now he can. But what if I give him something, he starts vomiting again? and then the airway starts to become a problem. You know what I mean? So let's hold off on anything that's gonna cause more vomiting. And we just don't need that complication. We have other drugs that will fix that problem. You know what I mean? We have a drug that's better suited for the patient's condition than oral glucose that may or may not work, right? Oral glucose doesn't always work. Doesn't always absorb enough. It's not, it just doesn't always work. But what will work every single time is an IV and a bolus of, D50 or D25 or D10, whatever our protocol is at the time. But that's what's going to work. And it's predictable. It's a predictable response. It's controlled.
I got a question.
All right.
Like from Mechanism, you guys didn't have a regulator in your bag?
No.
All right, man. Hey, y'all check your bags. 'Cause there's a fairy walking around.
Yeah, we know.
There's a fairy walking around here pulling stuff out of bags.
It might be an instructor fairy.
So if I were you, in the 15 minutes between scenarios, if you're about to go in the theater, I would just check your bag. That's all I'm saying.
When I got to work, I told y'all I used to do this all the time. Right, I throw my gear out there real quick, and depending on what I was doing that day, if I was riding tailboard, I would check my bags, make sure I had BBM, make sure I had some oral airways, made sure that I had a drug box, a monitor that worked, meaning I checked the batteries real quick, right? And I made sure I had an oxygen tank and there was something in it. It took 10 minutes at that. And then I went inside and talked it up with the boys for a while. They, get a report from them for about 25, 30 minutes. And then I would go back outside and do a full check. Right? It takes 10 minutes I would think, okay, worst case scenario is I get a call here any minute for cardiac arrest. Do I have that vital equipment that I'm going to need to work the arrest? Which I need a drug box, a monitor, a jump bag that's got a BBM in it, an oral airway, and like I already said. So get into the habit of, before you go into the theater, of just checking that basic stuff. All right. Anybody have any questions on that stuff there?
When ANO term, when his SpO2 dropped down to 89, they didn't bag because he was still conscious.
Right. As far as I know, he was not in. Right. As far as I know, he wasn't in failure. Is that correct? All right. So let me see. What was this? Was this a diabetic patient or was this a stroke? It was a stroke.
I think they threw that in there trying to curve.
Okay.
Make sure, we want to make sure that.
Is that why his stats were dropping?
Because his blood sugar is down.
Yeah, I started dropping. Like they just regulated, so I was like, all right.
Yeah.
I didn't even, honestly, like I said, I didn't even think with the blood pressure. Like I heard you say 40, I was like, okay. You know what I'm saying? Like,
And guys, we should be close enough now to where we understand the drugs that we carry and we know what they're indicated for, their contraindications, what they're not indicated for. We should start understanding now what we can do and what we can't do, right? We don't carry anything that can help blood pressure. And we should start understanding that. I don't have anything hid from you. You've got everything inside your scope of practice right now. And so you need to know exactly when it's indicated, exactly when it's not indicated, and what you can use it for. We should know that the dosages by now. We should know that we can't give nitro just to lower blood pressure. that it's not indicated for that it's indicated for when we need a post vasodilator for cardiac chest pain. We should know we don't give Tylenol for pain, that we give Tylenol, we don't give Tylenol for fever. Okay? We give aspirin, and we give aspirin for, okay, why? What does it do? Right, it's a platelet, right. Stops the aggregation of platelets. Right? I want everybody to be clear right now. We'll give glucagon if we can't get a line. Other than that, we're going to go IV D50. If the patient, is conscious, alert, not vomiting, needs a little bit of instant glucose because their sugar is right there 59, and somebody's going to go make them a sandwich real quick, you just don't want it to drop, go ahead. You got somebody that's lower than that though, and they're altered a little bit or something's up, just either put an IV in or drill them and go with your D50. I think we're good. I do think this team did really good about how they handled the O2 regulator though. They knew what to do, right? They didn't panic. And the team never panicked. I mean, they stayed with it. But never also be afraid to admit when you don't know something. Like if the Cincinnati scale, or if you don't know how to do something med control is asking you to do, don't fake it. It's not one of those things where you can fake it till you make it. That's when you say, look, walk me through. And I'll be honest with you, like the stroke assessments we do at the hospital are a little bit different. And just the other day, and I was on, we had that little, we call it tele robot. Basically all it is, it's like a Zoom. It's like a Zoom with a neurologist. And he asked me to do one part of the assessment, and I just couldn't pull it up out of my head how to do it. And so I was like, hey, Doc, tell me again how that goes. As soon as he told me, I was like, oh, I got it, I remember. And I remembered what to do. It was checking the peripheral vision. And he said, can you check the peripheral vision? I was like, yeah, sure. It just wouldn't come to my head. I had a lot on my mind. So don't ever be afraid to say, hey, I just don't know this right this second. You will have a lot on your mind. And it may be something you're expected to know. You just can't pull it up. The brain's overloaded. It's okay. Say, hey. And we're getting there with the teams. Every team leader now is taking info from their team. They're not trying to John Wayne it. They're not trying to let their team sit there like this while everybody's working now. Everybody's participating, and we've come a long ways. Okay, let's start the next go around.
One theater, 2 med control, 3 writing, 4 eval.
Oh man. All right, it's 10:15. I'll be back at 10:30. I did.
Saw that.
Actually, that's what they say. Like, the only good what I did, I actually, so I automatically think that phase. You know what I'm saying?
I think the toughest part for you is that, like, when you ask us what he looks like, we have to tell you.
Yeah,
So
yeah,
we tell you with facial, if you know, okay, he's having a stroke, but then you kind of go away from the test because you know he's having a stroke.
And then that's what I'm saying. That's why I told him.
Yeah.
Once I see that, I'll automatically say, all right, right on. You know that he's on the
You knew what was going on. And, yeah, I think about doing anything else.
So I don't think I got anything to say, except for open doors. But even like when I was at the Brooklyn, I used to do that. You got medication, you got all this.
All the looks good on your desk. Y'all laugh for a while.
Already here. That's what's.
It's a tough day in the world. It's a tough day in the world.
Oh, look at you.
Yeah.
Hey, Bradley, come over here. Hold on.
Bro, that's a bad day.
Dude, you were pissing me off. Dude.
Okay.
Dude, I looked over, you really like this.
Oh, man.
Dude, he's literally like, hey, where do you go if there's touch him on the shoulder? You already know everything you need, skin temp, skin color, and everything. Well, he said you-
How you doing, man? This how you do it. Howdy, how you doing? How you doing?
Find these two things. Side with this. So it goes in, you make this tight. That's how you do it. Dude. And that was like our third go around. And I was like, what the fuck is going on? Don't know. We have 500.
500 PSI.
Shut up. Pounds per square meter. So this
Oh. You know, we have this on my back. Take the regular roll. Stupid.
Fine.
Don't you go to that. Items. But you used to do more.
I touch him now. Why are we three black belts?
But I think you fast with this.
I do 50 seconds.
Why
Bradley.
Yes. Oh, that's pretty good.
In the book, it's only. All right, let me check my bag. I'm wrong, but that was my life. My life was, they ain't no recording. That was my life. He knows if I know I won't down my. He's never.
Bradley,
You'll find it. That's what I said.
I'm checking the song. Mr. Team.
Yeah.
How you doing, sir?
And it's out. I'll say the John.
Oh, yeah.
I don't think nobody.
What way?
What? Oh, no, I said in my desk.
Oh. And who's going next for our group? I went last time, Might not read right. That's adult size. Child size.
What? Oh.
Cool.
I feel like what I'm doing.
Was supposed to change.
Yeah.
Always do. I'm checking the bag. Stop doing the check sheet.
Someone's done it, don't they?
Drink coffee? Do you mind, Dolly?
Dude, on the AMR, was like, you just press on or see.
That's what I did.
Yeah, it went straight to that. Yes, sir. Just press C, goes off, I was pressing C.
I'll get a caffeine 2 days.
Yeah.
One.
Yeah.
Yeah, I was high the other day. The other day was 147.
Yeah, yeah, that was the thing. I didn't have like any. You got an 86.
I got a perfect pulse. 122 of the 30.
Every time I turn it off, someone else wants to do it.
That's what all
I had to cut out alcohol and caffeine. Hey, we got everything. Bags are good. There you go. That's what I do.
What are we doing?
Oh, dude, all this was. Yeah.
You got airway?
I got it. No, you have to do primary.
Yeah.
I mean, but.
Oh my God. Oh, so you're doing that.
No, I thought.
Put it on wrong.
Auditing got vitals. You know what? Auditing got vitals. You got like oxygen and everything like that. You'll be writing and helping me out.
Okay, route, I can do that.
Yeah, dude, that would happen to me on a couple patients. Like I couldn't get a good just start popping on. Yeah, I remember when we started. I was like 30. 149.
This might not be right.
No, mine just.
I don't know. Mine's
Yeah. This is a older machine.
That's why I was.
Yeah, everyone else get like 120.
Well, that's why I'm surprised I've never been told I have high blood pressure. Maybe every time I've done it here, it's been 140.
Really? Right. Yeah, I remember when we first started doing it, this was like 150.
Well, because I never had an issue, because like when we first learned, I told I use this, and it was like 123 over 70 something. And when somebody took it manually, worse than manually too, it was the same. That'd be the way to check. But that was a while ago.
I still remember when first time I had to do manual. I was like 140 over 80. He's like, damn, dude, that was straight on. I'm like, I just was like, shit out of there. Oh, then I did shit.
That's a lot.
Because
I doubt that.
got a score. I got a, like, my
Resting is
regular size.
according to my watch.
Plus, you can see my heart.
Mind you, I was reading mine yesterday and said I was at in the 40s. I was like, fuck, man, I'm about to die.
71 right now.
Wake up! I think it only works when I'm actually like yeah, right now it says 650.
So, it like hurts.
You try to get some aspirin. That might. I got an extra. Yeah, that's sort of.
So I think putting out, you're alcohol should bring it down. Right? Yeah. How much do you drink? Not that much. But I've drank more recently, like over the last week or two than I have in a while.
Yeah, like,
and I drink caffeine like it's either pre-workout or energy drinks.
Yeah.
Every day. Don't drink a ton of caffeine. When we first started, I was drinking like 2 Reigns a day at pre-workout. Yeah. And that's what I was drinking at least 1 with pre-workout. Now it's like I don't go above like 200 milligrams caffeine usually. See, my both the Reigns are 300, my pre-workout is 300. But I'm tossing my pre-workout. I just bought stim free time. Transparent Labs. Oh, theirs is really good.
I've heard that, and
use
I
theirs I
didn't
use
like,
theirs for a while.
I wanted to use their protein, and it was so expensive, it was like $60 for a couple of protein. And then, so I thought the same about their pre-workout, but I used Bucked Up, and Bucked Up is 50, because that's what theirs was. And
I'm not a fan of Bucked Up.
I like it because I didn't get as tingly and have really good flavor.
Transparent Labs, it's not, the stem one, dude, it used to be like itching, like
Yeah.
bad everywhere.
Well, I heard that you can still get that from, like, at least it's like, skin free.
Is that Beta Alex?
I think-
It's Beta Alex, and that's what,
And I think that, because I was reading reviews on it, they were saying that,
try some of the stem free. I have the stems in it. Really? It's straight, just like pump.
yeah, that's, I've heard that they're almost preferred because you get better pump, because it has, they put more in it.
Well, the
It's got a
stem,
lot of stuff.
the stuff with stems too, it makes your vessels constrict. So your pump is versus not getting blood. Like you can try mine.
That's why people use like that nitrous oxide.
That's what mine is for real about.
Oh, I've seen that.
It's really, really well. It's like $50 to get to 60.
I mean, that's what I'm, you know, how many servings?
I think the whole scoop, which is like the full dosage, is like 20.
Because, Transparent Labs is 30 servings.
It has like 5 grams of protein in it. It's like 10,000 milligrams of malate.
Yeah, that's a lot.
Vasodrive, AP, nitric oxide. If you like look at the dosages on it, it's way higher than everything else. The guy who made it is like he's like a steroid. But it's an actual like
Yeah. See, I need to look at it. I just read reviews and everyone said that Transparent Labs is really good. They said that flavors, I got strawberry lemonade.
I think I had that one when I haven't used it in a long time. It was like one of the first few products I had a year ago.
If I like it, I'm just gonna ask them. Probably for Christmas, I'll ask them. My parents like supplements, so I kind of stocked up for it. And if I like it, I think I'm gonna try to get like 2 or 3 different flavors.
It's nice. I mean, Gorilla is about 3 times discount. So I usually use what? Gorilla, if you guys get a discount, you know, it's this chunk code you can use to.
I get their pre-workout.
I get pre-workout, I get this thing called androgen receptor regulator. It's just heart rate and carcinoid. It basically just absorbs into your cells and makes them more like violent, testosterone and stuff like that. I have it's not pre-workout, it's just it's the stuff that's in their stem pre-workout, but it's not it's just caffeine. It's all I take before testing.
What I used to do is I'd get like I start off when I'd take Beyond Raw.
Oh yeah.
I would start off with that, but it wasn't as strong, so I would buy and raise the price, but I would buy my own container.
Oh yeah.
Add to it, and it was good. And I was getting really good pub, and of course you get used to it. And then the guys at GNC were talking to me about you can buy nitrous oxide. They were like something like pills, but it would open up. It would open up your powders. Oh really? Because I never did it just because of the price, because they wanted me to buy like the pills or $50 for a thing. But they said that it would open your blood
vessels,
yeah, and all that stuff would help with like endurance. Well, I might do. I might bring one tomorrow and go
transporting OT.
after my shaving. I get home.
I just figured out.
Brad.
Dude, they have olive oil in a can.
I don't know.
Remember that?
That's already I like olive oil. I like it, but I can't. So what I start doing is I'll do the, 2. You ready? How'd you make it?